Hi guys, my name is Sierra. Welcome to my channel, or welcome back to my channel. I'm currently a first year nursing student and I'm in my second term of nursing school, which is absolutely nuts because this term has gone by so quickly. We have 10 weeks in a term and we are on week 9 right now. It's the beginning of week 9. It's Monday morning around, no, it's not. It's Monday afternoon. And I figured I wanted to bring you guys along for a week in my life as a nursing student and just show you guys how crazy and hectic things have been for the past couple of weeks. I have a lot of assignments that need to get completed, projects that are due at the end of the term, remediation hours, volunteer hours, quizzes, and on top of that, I still have to study for finals. So it's a lot. Right now I'm in chronic illness, pathophysiology, and pharmacology. And then on top of that, I'm still doing clinical rotations at the hospital on the medical surgical floor. I thought it'd be fun to bring you guys along. Today I'm nannying and I'm gonna do a couple assignments that I'll show you. And then tomorrow I have clinical. The next day I'm nannying and doing some assignments, and then the next 2 days after that I am online via Zoom doing my classes. So it should be a really productive, eventful week. Lots to get done per usual, and I thought it'd be fun to bring you guys along. So let's get started. The first thing that I'm going to get started on is my discussion post for my chronic illness class. At the beginning of the term, each clinical group got diagnosed with a chronic illness, and we've been having to write in this discussion forum every week, answering various questions and things like that. So we have to do 2 posts answering questions and then 2 posts responding to other people's answers to their questions. So that usually takes me about an hour, because then we also have to add a resource that helped us answer one of the questions. So it takes me about an hour, like I said. So I'm gonna get started on that and do that, and then show you guys some other stuff. Okay, so I just finished my assignments for the discussion posts, and now I'm going to get started on my pharmacology projects. So at the beginning of the term, we were assigned 2 projects. Well, there are 3, and you only need to do 2 of them. You can do a 3rd one for extra credit. They're called the medication mansion, PDR guides, or a pharmacology charts. And PDR stands for personal drug resource guide. And I got kind of started on them in the beginning of the term with like hopes of, you know, being way ahead on my assignments, and that just didn't happen. So here we are doing them at the end of the term. I want to get them done this week so I don't have to worry about them during finals week and I can actually study for my finals. So I'm going to show you guys what they consist of. So right here is my list of medications from pharmacology that we are going over in this term. And these are the medications that we will be using for our project. So we take 10 medications for each project and we can choose whatever we want. Right here is my drug guide. This has all the information I need for the medications, like the side effects, the nursing implications, the interactions, considerations, the dosage, things like that. I got these big flashcards. I'm gonna use these for my personal drug resource guide. And so I'm gonna put a drug on the blank side and then I'll fill it out with all the information. And I have to do 10 of them. And then I'm just gonna like poke a hole, I think, in the corner and make it a little ring and have it be like a little book. So that's what I'm gonna do for that. This is my medication mansion that I kind of got started on. I got this poster board. Now I actually need to write in it and write the medications. So I'll be writing where medications are stored in the house. So what medications you'd put in the bathroom, in the kitchen, in the living room, where you'd have in the garage, in the refrigerator, things like that. And then the last one is, I wonder if I have it with me. It might be at home. What's nice about those projects is my teacher is actually giving us 5 points of extra credit per project if we handwrite it. So I'm going to get started on some of that now. right, so I'm going to take a break from those flashcards because my brain is turning to mush. I'm gonna fold some laundry, but one thing that I always do to help me study for pathophysiology is I watch videos on YouTube. There's a lot of videos obviously that go into depth on certain concepts and principles from the patho book, but there's actually an instructor on YouTube that records his lectures, and his lectures are from the same pathophysiology book we use at my nursing program. So he follows right along with the book. So I get the lecture in class with my actual instructor, and then I watch these videos on YouTube with him lecturing the book and the chapters that we're going over, and it just instills the information in my head even more because we have a lot of chapters that we cover in a short period of time. I remember somebody in my clinical group mentioned during week 7 that we had a total of 10 more chapters that we were covering in the next few weeks before a final. And I was like, oh my gosh, it's a lot of information, and our final is actually accumulative, so it's over everything we've learned from the beginning of the term. So pathophysiology is a very time-consuming class. So I'm just gonna listen to his lecture on YouTube and fold some laundry now. Knock, knock. Knock, knock. Hi, how's it going?
Good.
Good? What you got going on in here?
I got a lot of things everywhere.
Hey guys, so I just got home. I'm going to make some dinner, do some more reading for some of the skills that we're going to be getting checked off for tomorrow in clinical, and then I'm going to print off my papers that I've talked about in previous videos. Basically, every week we have to pick a patient at the hospital, and then we have to do a full head-to-toe assessment on them, and then a patient care plan, which at my school is called a clinical judgment worksheet. And this worksheet is like approximately 15 pages, but after you fill it out, it's around 20 pages. A lot of the details that you fill out, you actually fill out at home, because a lot of it is medical interpretation, Tanner's reflection, your competencies, the pathophysiology of the patient, and you do that at home. You're not doing that at the hospital. But there's specific information that I need to get at the hospital, like lab values, the reason for admittance, prior medical history, things like that. So I made a condensed version, just like 2 pieces of paper that I print off front and back, so it might be 4, I don't know, it depends on how the printer is feeling today because it changes every time, I swear. It's just like the quick things that I need to write down and get about my patient, so I don't have to spend a lot of time doing that, and I can spend more of my time shadowing my nurse and hopefully doing skills and working with patients. So I'm going to show you guys that document, and then I'll probably see you guys tomorrow. Alright guys, this is the document I was talking about. It is called a clinical judgment worksheet in my school, but it's just a condensed version that I made for my clinical group and myself, and I bring to the hospital. So we just get the patient's information and we fill all of this, and a lot of this we can gather from our head-to-toe assessment. Oh, I did front and back. Nice. And then yeah, some of it I do gather from their charts on the computer system, just because sometimes we do have patients that are not very cognitive and they can't actually answer a lot of these questions. So it's really nice to have this chart so I know exactly what I need to write down for school. So that is that. It's getting later in the evening on Monday. I will see you guys in the morning for clinical. I have to be up around 5 in the morning to go to the hospital. So I'll see you guys in the morning. Bye. Hi guys. It is now Tuesday. I just finished up with my clinical rotation at the hospital. I was on the surgical floor today. It's around noon and I'm on lunch, and then I'm meeting back on my school campus to finish our clinical day. So I'm gonna eat some lunch and then I'll chit chat with you guys about my day and go over how everything has been. It's so nice and sunny here I'm ready for summer. Hey guys, so I just finished up with my clinical day. It's around 5 o'clock. So my clinical day is usually from 6:30 to 5 in the afternoon, evening. I spend the morning at the hospital, and then we break for lunch, and we spend the remainder of the day on our school campus doing clinical on campus, performing different skills, kind of debriefing, talking about our day, our patients, diagnoses, our patient care plans, and things like that. So it's been a long day, but I just found out actually this was our last week in the hospital because we're on week 9. And then next week is our last week of school, and we're actually not going to the hospital. We have a really short day, and it's just gonna be at school, and I get to sleep in, so it'll be nice. But yeah, today was a really good day. So at the hospital, I was put on the surgical floor. I had a really awesome nurse because not only was she a nurse, but she's also a care manager, so she has a lot of experience, and so she was very good at teaching me things, and I was very impressed with her. So we had 4 patients. One of our patients left pretty early on in the morning because she left for surgery. I had 3 other patients, and I picked my patient for my care plan or my clinical judgment worksheet, and it was really interesting because we talked about ostomies in school and stomas and what they look like and how to care for ostomies and ostomy bags. But I've never seen a stoma in person, and I actually got to see that with a patient who had diverticulitis. So she got surgery, and she has this large wound on her abdomen, and they created a stoma for her, and that was really interesting because I actually got to see it because we changed the ostomy bag. I think that's what it's called. So yeah, that was really cool. Just good to be on the floor and be with different nurses because I feel like I learned so much from each nurse, so many different things, because they all bring different things. They have different experiences, they have different ways and tips and tricks that they do things, like passing medication, just their morning rounds, their routine, I guess you could say. And I feel like I'm really enjoying it because I'm grabbing bits and pieces of what I like from each of these nurses, and I'm going to incorporate into my practice, hopefully. It was really good at the hospital. Past medication, I gave a Lovenox injection, and so that is a subcutaneous injection that is administered in the belly, and that is for prevention of blood clots. It's a blood thinner, and this is something that I learned recently. I forget what it's called. Deep vein thrombosis. It's DVT prophylactic. I think I'm saying it right, and it's across the nation, and anytime a patient is admitted into the hospital, there needs to be something administered to prevent blood clots. And this could be an injection like Lovenox, which I gave. One that is common is heparin. People also receive TED hose, so the tight socks around their feet, the non-skid socks, and scuds around their legs. So yeah, that's something I didn't know, that every patient is treated with that. Obviously the best course of action to prevent blood clots once you're admitted into the hospital is ambulation and walking. However, if you've recently gotten surgery or you're really feeling quite terrible, and that's when this comes into play. Hospital day was really good. We met back at school, and we were just getting checked off for some of the skills that we needed to get finished by the end of this term. We talked about a couple different things. We were talking about certain chronic illnesses, some that require droplet precautions, airborne precautions, standard precautions, universal precautions. I think actually standard and universal precautions are the same thing. What was the other one? Oh, no contact precautions, I believe. And then we had a long discussion about fibromyalgia. Not really sure why that happened. And anyways, it was a really good day. I feel bittersweet. I am so happy that I don't have to wake up at the freaking butt crack of dawn next Tuesday again, because I do live kind of far away from my school, so I have to drive a little over an hour every morning. Everything went good today. I feel like I learned a lot, and I'm just happy to be here. As hard as nursing school is, especially with all the assignments and all the learning that you're doing and the time that you're putting into it. The clinical days just remind me of why I want to do this, and it's always just extremely refreshing to get your head out of a textbook and to have hands-on experience with patients and really be learning and utilizing the knowledge that you're gaining. I am not very good at talking and driving, so I think I'm gonna end this year. I'm gonna head home, eat some dinner, work on a couple of my assignments. This is my last patient care plan that's due for this term. That's that 15-page document that is so long and very informative and helpful, but it's very time consuming. I will probably see you guys bright and early tomorrow morning. So see you then, bye. Hi guys, so it is Wednesday right now, and I've always said that I'm going to keep it completely honest and real on this channel, and that's what I'm doing. Today started off really good. I got a group assignment completed. We had to do an essay. It's like a whole personal resource manual on childhood depression. We each had a couple different portions, like a page and a half, to do some research on it and fill it out. So I finished that. I took a couple of my pathophysiology exams, and then, well, I found out I messed something up. I submitted an assignment and I messed it up. I'm not sure what to do right now. This is like a huge assignment, and I spent 10 hours on it, and I submitted the wrong thing, and that 10 hours that I spent on it, that assignment's gone. I just spent another hour trying to recover this document, and I can't find it. Basically, I'm going to spend the rest of the day redoing the assignment. I don't know what's gonna happen. I just want to say, double check your work before you submit it. Make sure it's the right document. Good morning, you guys. I know I didn't talk to you guys much yesterday, and that is because I needed a moment to calm down. I kind of had a freak out moment. I turned in an assignment and I didn't pay attention to what I turned in, and it was a duplicate assignment, and it's worth a lot of points, and you can get in a lot of trouble for doing things like that, for not double checking your work, paying attention. It's kind of a long story, but I was just freaking out. Two things happened. I don't have autosave on my Microsoft Word, so if this is a lesson to anybody, please put that on so you don't do 10 hours of an assignment all to have it be gone. And then I also, I mean, I typically do this, but when I submit an assignment, right after submission, I check and look at it because you can see what the instructors are going to be viewing. But sometimes, I mean, specifically this last time when I turned this in, I just spent, like I said, 10 hours on it, that as soon as I turned it in, I just shut my computer and was like, hallelujah, I was ready to relax. If this can be a lesson to anybody, double check what you submit after you submit it and have your autosave on, and just be more diligent, I guess, than I am, because this is nursing school. It needs to be taken very seriously. So that was a bump in the road, but that's gonna be okay. Everything's going to be okay. Thank you to my brother for calming me down, and a fellow student in my cohort who I spoke to. She helped me calm down too. It's a new day. It's a beautiful day here in Oregon, and it's gonna be a really good day. Do you want to say hi? You want to say hello? Hello. So today's Thursday morning. I have class, which is gonna be chronic illness. And so we're gonna discuss our personal resource manuals about childhood depression that we turned in. We always go over all the questions answered and discuss it as a class. And then maybe talk about the final exam that's coming up. I'm not sure. I have some other assignments that I need to get done today, so I will show you guys those. All classes on. I just turned my camera and mic off. I'm probably gonna clean the house. It's kind of a mess in here. And then make myself some breakfast, then go on a run and just have a good day, because sometimes things just happen and it's okay. Gotta roll with it. Enough complaining. Let's get on with our day. Look at this. Hi. You want to say hi? Hold on one second. I just finished my run. It's so nice outside. It honestly almost feels like summer. It's so exciting. It's like that perfect temperature where it's sunny, but it's not super hot. So anyways, I'm just gonna sit outside and work on some homework. I'm gonna work on my patient care plan. My clinical judgment worksheet is due on Saturday, just because I have so much other stuff that I need to get accomplished. I'm gonna try to get most of that done today. You wanna say hi? Hello. Good. Hello. Hey guys, it is me again. It's so nice out. I just want to go get my car washed and clean it out. And yeah, it's amazing how much cleaning you'll get accomplished when you're supposed to be doing your schoolwork. Because cleaning sounds better. Anyways, I'm gonna do that and then head home and continue slaving my life away. Hi guys! Okay, so it is Friday. I'm sorry it's so noisy. I'm also sorry I haven't recorded anything today. This is my mother. I had 2 classes this morning. I had Pharmacology, Pathophysiology, and yeah, now I'm with my family. We just had dinner and we're just hanging out. Anything that you'd like to say, Tara? You don't have anything you'd like to say? Anything you want to say to the YouTube people?
I'm proud of Sierra. Keep going.
Hi. How are you?
Good.
What's happening? What is she doing? She's acting like a dog.
I haven't been here for a while.
Yeah, he's grown up. It's been a couple weeks. Let's show them your
More
haircut.
than a couple weeks.
He's got a fresh new cut.
If your parents still pay for your haircuts, you're all good.
So I'm going to end the vlog here. I've just been in school and then I've just been avoiding more school because I was in class for like 7 hours. Oh, do you want to come say hi?
Leave a
Anyways,
comment on your favorite Pokemon.
Thank you guys for watching. I hope this was informative. This is really what my life looks like as a nursing student.
Yeah.
I'm just trying to take a break and spend time with my family. But I hope you guys enjoyed.
Hi, Dorothy. Sorry.
You don't know who she is. I think she just randomly came into the house. Who are you? Thank you guys for watching. I hope you have a good rest of your morning, afternoon, or evening.
Day.
And we'll see you guys in our next video.